Come to Ringdale or?
He's aware, Chair. Chair, it's now 7 o'clock and we are live on YouTube.
Thank you, Mike. Good evening, everyone. Welcome to this meeting of the Covid-19 Response and Recovery Scrutiny Panel. The meeting is being streamed live on YouTube, so good evening to any interested viewers that may be viewing the meeting tonight. Can I ask for patience should the meeting move at a slightly slower pace? This will allow us to work through the agenda and deal with any technical issues that may arise. To ensure audio for this meeting is as clear as possible, we will be muting all microphones as a default setting to keep background noise to a minimum. When wishing to speak, I would ask if any attendees could raise their hands and wait to be invited to speak by myself. Your microphone will then be unmuted and you'll be able to speak. Panel members are being asked to vote by raising their hands to indicate if they're in favour, against or wishing to abstain from the motion. Item number 1. This item is to receive apologies for absence. Can I ask if there's been any apologies submitted?
No, we haven't had any apologies, Chairman. Thank you.
Thank you. Agenda item 2. This is to consider any declarations of disclosable pecuniary or personal interests and non-disclosable pecuniary other interest. Can I ask if there's been any declarations?
Nobody's indicating, Chair.
Okay. Agenda item 3. This item is to approve as a correct record the minutes of the last meeting held on the 10th of December 2020. I'd like to move it. Have we got a seconder for the minutes? Okay. Those in favour, please indicate. I think that's unanimous.
Sorry, Chair.
Agenda item 4.
Seconder, was that Councillor Blagden?
Councillor Blagden, Mike, yeah.
Just for Lynn's notes.
Agenda item 4. This item concerns the Covid-19 response and recovery, with particular focus on the NHS and Kingsmill Hospital and partnership working with the council. In attendance this evening, we're delighted to have Richard Mitchell, the Chief Executive of the Sherwood Forest Hospitals and NHS Foundation Trust. Before I bring in Richard, we sent an email out last week, Richard, and we asked the public to, if they wanted to make a comment about Kingsmill Hospital and how they cope with the pandemic. So I'd just like to read you a few, if that's okay. So this is a resident in Kirkby in Ashfield. Thank you, NHS and all key workers. Just a thought, but could all frontline staff such as postage, shop workers, council workers, emergency services receive the vaccination after the most vulnerable groups have been completed? The next one is from a resident in Harlow Wood. The staff at Kingsmill Hospital have been amazing. I can't thank them enough. The service that my father received was incredible. I've no doubt they saved his life. They'll be forever in my debt. So there's some nice words there. This one is I'll just read you one more from a resident in Skegby. The staff at Kingsmill Hospital have been brilliant. They must have been under incredible pressure. I can't remember a time when the NHS faced so many challenges. So, and we've had dozens of them, and I'm quite happy to put them in a folder and send them over to you, Richard.
Thank you.
So, before I bring you in, I'd like to ask if there's any senior officers in attendance for their input or questions they may wish to ask. I don't know at this stage if Carol or one of the senior officers just wants to make some comments on behalf of the council.
I think the Chief Executive's indicating that she'll wait until Richard's finished.
I'll wait, but just a very quick thank you to Richard for coming tonight. I know you've got a zillion and one other things that you've got to deal with at the minute. We, as a council, we really appreciate the time that you've taken to attend tonight's meeting, and also for extending the facility to our key frontline workers to get the vaccine on a priority basis. Chairman, we managed to extend the invitation to 51 members of the housing repairs and homelessness teams at the weekend, people that deal with people in their homes. So that facility has been extended to our frontline key workers. So my thanks to Richard and his team for doing that. Thank you.
Okay, Teresa, did you indicate you'd like to say a few words?
I did, Chair, thank you very much. But to be honest, Carol said everything that I would like to say, and just welcome to Richard. We work very closely alongside Richard and the ICP team, so it's great to have him this evening, and it'll be an interesting debate. So looking forward to it. Welcome, Richard.
Thank you.
Thank you, Teresa. So before bringing panel members, I'd just like to bring in Richard now, just to talk about some of the challenges that he's had as Chief Executive of Kingsmill Hospital. Richard, we're delighted to have you tonight.
Thank you, and thank you for the invite. Can I just check before I sort of speak for 5 minutes? Can everyone hear me okay? Someone thumbs up? Yeah, perfect. Yeah. Thank you. Thank you for the invite. Thank you for the kind words. I'm Richard. I'm the Chief Exec at Sherwood Forest Hospitals. We've got Kingsmill Hospital, Mansfield Community, and Newark Hospital. And I've also got a role as the Executive Lead of the Mid-Knots Integrated Care Partnership, which is one of the sort of areas that we work with Teresa and colleagues on. And through the Mid-Knots ICP, we're trying to fully integrate care and health services across the community, working with the local authorities, primary care, Knots Healthcare, voluntary services and other. I'm just going to say a few words about COVID, but I'm certainly here to answer any questions or comments that people have. And I will come back to the point that was raised at the beginning about vaccination and the priority grouping. I'm clear, we're clear that our response to COVID has been a system response. It has involved all members of the health service, the care service and the voluntary partners working, I believe, effectively together. And if any of us had forgotten, let's just remind ourselves that we've pretty much now been living with COVID in our working and our personal lives now for 12 months, and it's taken a huge toll. But I would, at the beginning of this, just like to take the opportunity to thank all of you for your fantastic support over the last 12 months. I think we have got through this together, and certainly as we try and or hopefully emerge from COVID at the rate that it is in our community and our organisations, will need to continue to work together over the coming months and possibly years. So in terms of COVID, at Sherwood, we tried to set out to achieve three things. The first thing was about the provision of safe care for all patients. The all patients is obviously referencing COVID, patients with COVID, patients on emergency care pathways, patients on cancer pathways, but also not forgetting that we have very important diagnostic and planned care services. The second of the three things was looking after each other and ourselves. As I said, we know that COVID has impacted on our personal and our working lives now for a year. Colleagues have been wearing personal protective equipment for 12 months. It had a huge impact on them. Colleagues have been working from home 5 days a week who normally would be working on site. It's had a huge impact on them. We've all got shared experiences. We've all got different experiences. But what we wanted to do was try and provide as much welfare and well-being support to colleagues as soon as possible. And I think we've done that effectively. And then the third of the three things was trying to remain proud about what we're doing despite the pressures that we're under. And I certainly think, whether you view it through the lens of sort of the system across Mid-Knots, whether you view it through the lens of Sherwood Forest Hospitals, I think there's lots to be proud of. So some things that you may be unaware of, our personal protective equipment plan rolled out very quickly at the beginning of last year, PPE for short. We got into a position, despite, you'll remember in the media, lots of understandable national concerns about access to PPE. We're in a position where we're able to provide mutual aid to lots of different partners, primary care, care homes, funeral services, not only across Mid-Knots, but across the Midlands region. So I think our ability to support others with PPE is a point to be proud of. We were the first NHS trust in the country to offer 24/7 vaccination. We did it as we heard earlier, 2 weeks ago, and we now plan to have got the agreement to continue with that. We've been identified as one of the top 5 NHS providers in the country for its vaccine provision. And finally, I don't think it's luck, but we're very proud that we haven't lost any healthcare workers at Sherwood due to COVID. Obviously, let's be honest, luck does play a role, but I think the way that we have approached our IPC the way in which we've been supporting people with personal protective equipment, the way that we've been supporting people to balance their welfare and well-being. I think the fact that we haven't lost any colleagues due to COVID over the first 12 months, we obviously wouldn't go out and celebrate it, but it's something that I think is important to remember. So as of today, we have 161 patients with COVID in our organisation. Sort of as 2 points of comparison, the peak last year was about 90 patients over the Easter weekend, so nearly double the number. But if you were to rewind 3 weeks ago, it was about 220 patients. So we believe that we have passed through the most recent peak. It's dropping off. It's not dropping off at the rate that we saw in 2020. The organisation is still incredibly busy, but we're optimistic that the steps that have been taken around restrictions around sort of people moving around the country, and also the rollout of the vaccine program, we believe that it is working, and we're hopeful that it will continue to work. Within those 161 patients, we've got 14 patients on intensive care, so they are the most critically unwell patients, and we've got 5 patients on top of those 14 on critical care who don't have COVID. Our sickness absence rate is currently running at about 10%. Across clinical and non-clinical colleagues. At this time of year, normally about 4.5%, so it's double that, and that double is linked into COVID. It's about 4.5% for non-COVID reasons, 5.5% for COVID reasons, and we continue to have no issues with access to personal protective equipment, the PPE. In terms of vaccinations that have been touched on, obviously the vaccination programme is a national programme. It's a regional programme across the Midlands. You've then got the Nottinghamshire programme, and then you've got Sherwood, which is a small but important cog within that. At Kingsmill, we rolled out the vaccine programme on the 8th of December. We've currently vaccinated in excess of 25,000 people. We are vaccinating people 100% in line with the Joint Committee on Vaccination and Immunisation Prioritisation, which is the JCVI. We have been vaccinating over 80s. About a quarter of the people who have been vaccinated through Kingsmill have been over 80s. We've been vaccinating people within care homes and care home workers. That's about 20% of the people vaccinated. And then the remainder, which is about 55%, have been NHS workers, people at Sherwood, but also people at Notts Healthcare and other NHS organisations. Just going back to the question that I think was raised about identifying other people to bring forwards, quite simply, it's not something that I can influence and control. If the groups of people that were identified are within the next priority group, we can be vaccinating them. And if they're not, we simply are unable to do that. I think given the way that the vaccination programme has been rolled out, which I believe is pretty effectively nationally, I think it's about 9 million people vaccinated, we would hope that we can very quickly get through those priority groups and get the majority of people vaccinated within the next couple of months. I'm very happy to, of course, answer any questions about vaccination and also possibly questions about the second dose. So that's all sort of taken us from where we were 12 months ago through to today. Just briefly on the future, the reality is I think the future for all of us remains very tough. If you view it through the lens of Sherwood, through the NHS, obviously we're going to continue to have COVID in our organisation and our community. And that means that the way of working that's evolved over the last year has to continue. And that brings pressures. We've clearly got an important need for colleagues to rest and to recuperate. I think welfare and well-being is essential. We see people now facing huge psychological trauma from the pressure that they've been under for the last 12 months. And I'm really clear that the organisation I work in, we need to give people that opportunity to rest and recover. And quite simply, obviously saying, right, have the weekend off and let's crack on again on Monday, that's not going to work. But I do also recognise that there's a balance here. And we have waiting lists that have grown literally exponentially over the last 12 months. We were very proud, and we are very proud about access to emergency care. The emergency care department at Kingsmill provides the most timely care across any department in the Midlands and is in the top 5 in the country. So we believe timeliness of care is an important contributor to the overall quality. We've been able to keep our cancer services going, but we know that patients who are waiting for diagnostic tests, and certainly patients who are waiting for elective or planned surgery, be it day case or inpatient stays, those waiting lists are much, much higher now than they were 12 months ago. So I think Where we're going to be focusing on at Sherwood is continuing, hopefully, to be a cooperative and collaborative partner, working with Tues and others to really strengthen the health and care provision across Mid-Notts, continuing to focus on the welfare and the well-being of everyone who we work with, but also recognising that we've got lots of patients now who require treatment, and we need to begin the process of reducing the volumes of patients waiting for our services. So as I said at the beginning, thank you all so much for your support. We are very proud about what we've achieved through Sherwood. We're very proud now. Many of you all have been sort of in Mid-Notts for a number of years, and you would have been aware that the position the organisation was in 5-6 years ago now. But I genuinely think we've got 3 hospitals that compare exceptionally well to hospitals across the country, and we look forward to continuing to work with you over the months and years ahead. Very happy to answer any questions.
Thank you, Richard. And you know, what's clear from what you were saying was, you know, it's been a huge challenge. There's no getting away from it. I wanted to ask you, and I think you did slightly cover it, about the impact on other services that you provide. There must have been a longer term impact, and how are you dealing with that?
So there's been a huge impact. If you pre-COVID, we would, I would probably divide the organisation into 4 pathways. So emergency care pathways, cancer care pathways, diagnostic pathways that often lead on to other parts of the organisation, and elective care or planned care. Our emergency care provision, as measured by the percentage of patients treated within 4 hours, continues to compare very well. But what we did see during the first wave, or for the majority of last year with COVID, is the volumes of patients requiring emergency treatment dropped off dramatically. And that was a huge concern for us, because the patients who would normally be presenting with heart attacks or strokes or other requirements to be in hospital simply were not presenting, and those conditions wouldn't have gone away. What we are now seeing is a return to normal levels of emergency activity, in particular for the patients who need to be in a hospital. So emergency care, we're doing okay. Cancer care, we were able to protect that pathway and to keep it going. Again, because of things like infection prevention control, IPC, it means that our ability to care for patients, say in theatres, it takes longer now to get patients ready for surgery, longer to operate, longer to take them back onto the wards, etc. So within that fixed asset of theatres, we're now bringing fewer patients through for cancer services. So unfortunately, patients are waiting longer than they would have wanted, or what they want, and certainly longer than we want for their cancer treatment. But we're being very open and honest with them. And for any patients who are waiting, we're doing harm reviews. What we have seen, unfortunately, is fewer patients going to primary care to say, I'm concerned about X, and then being referred in. So we haven't seen that return to the levels of cancer referrals that we'd have seen pre-COVID. And similar to the emergency care, we understand why, but that concerns us. It's the diagnostics and elective care that's really been hit. So in the NHS, for elective care, planned treatment, one of the key indicators, or sort of the furthest point you could ever expect between being referred in by your GP to having your treatment, could be 52 weeks. And the NHS has worked exceptionally hard over the last, 12 years or so to get it down at one point to hundreds of patients nationally. And Sherwood, on the 31st of March 2020, had no patients waiting in excess of 52 weeks for surgery, because the vast majority of those elective care pathways have slowed down over the year, partly because there's a national mandate for 6 months of the year to do no elective work and to focus on COVID. You can imagine that those numbers have increased dramatically. And we now have, I think it's in the public domain, that nationally there's something like 250,000 people waiting over 52 weeks for treatment. And in Sherwood, it's probably about 100 patients or so. So we are prioritising our patients based around clinical need, length of time waiting, emergency care and cancer treatment are the priorities. We're focusing on those, and we hope over the coming months and years that we can get back to where we were before. but it will take a huge amount of work. And again, I would just recognise that I don't think switching from focusing on COVID to going full steam ahead to non-COVID services is going to be possible, because people are just so tired at the moment. I hope that answers the question.
Thank you, Richard. Yeah, I'm now going to go through the panel members. So I'd just like to introduce Councillor John Smallridge, who represents the Carsick area. John, is there any questions you'd like to ask Richard?
No, I've had a very good treatment, and I went to Ashfield Health Village at Kirkby, and on the weekend, and the staff there had to work till 8 o'clock at night that night, the one that I saw, and they were extremely helpful and cheerful. So I think it's a great job. Thank you.
Thank you, Councillor Smallridge. Councillor Caroline Wilkinson, she represents the Dales area in Sutton. Caroline.
Good evening. I do have one question. I've got quite a lot of over 80s in my ward, and they just want reassuring that there is enough stock for their second jab. After listening to the media, most of them have actually had the Pfizer jab, and they're worried that there won't be enough of that vaccine for them to have their second jab.
Yeah, obviously an understandable concern, and something that's playing out nationally. The simple answer is I know no more about this than anyone on this Zoom call. I think it's highly unlikely that the country will run out of vaccine to the extent that people booked in for their second jab or it be moved beyond 12 weeks. I'm sure everyone is aware that the vaccines rolled out initially with the Pfizer vaccine. The plan was to bring people back between 3 and 4 weeks. And then understandably, and I do support this from a public health perspective, the benefit is trying to get as many people through the priority groups vaccinated with their first dose. That was the reason why it was moved from 3 to 4 weeks back to 12 weeks. So an extension of between 8 and 9 weeks. I can't say for certain because I haven't seen the information. But I think it's highly likely that everyone will have their second dose spot on that 12-week window.
Okay, thank you.
Anything else, Caroline?
No, that's it. Thank you.
Okay. Councillor Dave Shaw. Dave represents Hucknall. Whilst that's not in your patch, have you got any questions, general questions for Richard, Councillor Shaw?
Richard, thank you. And my thanks out to all the staff at Kingsmill and Sherwood hospitals. What I've gleaned from your statement tonight is that whatever's happened has been equitable across the board, without favour, without prejudice of finances or anything like that. It's been absolutely dead level, dead even for everyone approaching that. Whether you're rich or poor, you're going to get the jab as and when you need it. My concerns are for the minority ethnic groups. How can we persuade more of those people to actually take up the offer of the vaccine, and what can we do as a council to promote it? Thank you.
Thanks for your comments. So the first bit I would say is, as I referenced, that the vaccination programme is based on a network principle. And obviously the numbers going through Kingsmill are part of the numbers across Mid-Notts. If you look at the numbers of workers at Sherwood Forest Hospital's NHS Foundation Trust, I think the numbers I saw last Friday, we were at 56% of colleagues had been vaccinated. Within that, 53% of colleagues from minority communities have been vaccinated. So we were able within our organisation, just of the NHS workers, not quite parity, but I think that 3% is a marginal difference. I think that's because within the organisation, we have been able to communicate very effectively the benefits of having the vaccine programme. I haven't yet seen the numbers across the Nottinghamshire region broken down into people from a minority community and others. I would suspect, though, that there is more of a gap than the 3% that I've described within Sherwood. And I think there's a range of things we need to be doing to communicating it effectively. I think part of it is about working with community groups and working with influencers in those groups to try and dispel any myths about why people would not have the vaccine. And the flip of that is also to be absolutely clear that the vaccine is safe. It's the best way of protecting yourself and others. So within Sherwood, we've got a good program that's doing that, and we will be working with partners across Mid-Knots to see progress. And I think ultimately success needs to be measured as whatever percentage of the wider population sign up to it. And I, not being defeatist, but I don't think we'll get to 100%, but I think getting to 90 or above would be success. And we should certainly then, as we cut into that group through any form of demographic, I think success is seeing exactly the same proportion of people vaccinated. We've made progress, but we've got more work to do.
Thank you. Thank you very much. Thank you.
Anything else, Dave, or you happy with that?
No, thank you very much. That's a brilliant answer from a brilliant guy that's working 100%. Thank you, Richard.
Thank you.
Okay, I'd like to bring in Councillor Kevin Rostons now. He's another Hucknell councillor. It's a very Hucknell-dominated committee. But have you got any questions for Richard, Kev?
A massive thank you to start with, Richard. You're doing a wonderful job. The initiatives you've began and to look after your staff, which it's been exceptional, because the staff are at the forefront of your operation. And are you continuing with those initiatives? I know you started various things for them, and coffee mornings and various breaks, etc. How are you keeping your staff inspired? Because without them on board, we're all in a sad state. But you are doing a wonderful job, so thank you. Keep it up and keep looking after your staff. Thank you.
Just before I answer the question, I feel slightly embarrassed with sort of the praise that's coming. I'm absolutely clear, and it's not me just sort of saying this. I'm really fortunate that throughout this, my role has been relatively manageable compared to the vast majority of people who have been, as I say, wearing PPE for 12-hour shifts, working under extreme pressure, huge pressure in their personal lives. I've felt very fortunate, and that's because we have got at Sherwood what I believe, I'm heavily biased because I've recruited most of the people, but I think we've got a really, really strong team that goes about things in the right way. So I will certainly pass on your message to the wider organisation, because we've got 5,500 wonderful people at Sherwood, and we're very lucky that they choose to work with us. In terms of the point about the welfare and well-being, if I'm being honest, I think we recognised very early on that welfare and well-being and truly focusing on it was going to be incredibly important. But I think, as with like a lot of these things, we tend to sort of layer initiative on initiative, and we at times have slightly lost our way. and my view, and sense checking it with a whole range of people, whether they're clinical or non-clinical, whether they're working on site or working from home, what the vast majority of people want is us to focus relentlessly on the basics. And what I mean by that is ensuring that, sort of from a psychological perspective, they've got all the things that they need in place. And the big determinants of happiness at work are you working for somebody who cares about you? It doesn't, again, it's not me being humble, it doesn't matter who the chief exec is, because most people don't see me on a day-to-day basis. The biggest determinant is, have you got a line manager who cares about you? And I can bore you to tears by providing you with evidence now that we've really shifted that over the last 4 years. The other big determinants are, do I think I've got a job that's manageable? And for us to ensure that, it's about ensuring that we've got sufficient people working, that the clinical rotas are as full as they can be, that we're supporting people. I haven't used the word yet tonight, but guilt's really important. People feel guilty to take a 15-minute break in a 12-hour shift. People feel guilty to take a day's annual leave when they've been working for who knows how many weeks. So we need to support these people to recognise that they feel guilty, but they have nothing to feel guilty about. And for me, it's that return to basics that's incredibly important. Something that we haven't particularly publicised, but possibly the thing that I might be proudest about in terms of our responses. We know that but across Ashfield, Mansfield, Newark, there are high levels of deprivation, and we do have quite a high number of people who work at Sherwood, whether it's through MediRest or Skanska or on our bank or full-time employment, who pre-COVID were using food banks. And one of the things we were quite keen to do was to focus on the people who needed our support the most during COVID. And right at the beginning of this, without much fanfare, we rolled out a hardship fund where people could access relatively small sums of money for the organisation, but meaningful sums of money to them by having a conversation with the chief nurse on the understanding that it would support their ability to bring food into the family and things like that. And we've spent, I think, please don't quote me on this bit, but I think we've spent something like £15,000 on that across about 150 people last year. And we're continuing to roll that out. And that's something that I'm really proud of, because I firmly believe, as I said, in looking after everybody, but certainly keeping an eye on the people whose lives, often for no fault of their own, are more difficult than others.
Thank you, Richard. I'd now like to bring in Councillor Dale Grounds. Dale's a councillor in Kirkby in the Kingsway ward. Dale?
Hi, Richard. First of all, I'd just like to say that thank you, and you guys are doing a fantastic job at the NHS. I've got two questions. The first one, in my spare time, I spend a lot of time at the children's wards in Nottingham as Spider-Man visiting the kids, and those guys are doing a fantastic job over there. So I'd like to ask, how has COVID impacted the Sherwood Forest Hospital's children's wards and their services, and has there been many children with COVID?
So the second bit is that I don't have the numbers, but very few children have been presenting with COVID. I think it's been well publicised nationally that COVID hasn't been a virus of the young, and certainly children who have been having it haven't been so severely impacted that they have to come into the hospital. I can't remember whether we've had any children pass away with COVID, but we've certainly had low levels or low numbers of children with COVID in the organisation. How has it impacted on services? Our children's services have been impacted because, again, I think I referenced there was a national mandate for a lot of last year about elective care, so planned care, whether it was outpatients or inpatients day cases, simply had to stop because there's that huge concern about we don't really understand the virus. We need to do everything possible to reduce the footfall into the organisation. But we have got a wonderful children's service, like many services at Sherwood Forest hospitals. There's something called the Care Quality Commission, the CQC, equivalent of Ofsted for schools. Kingsmill's the only outstanding hospital in the Midlands, and the children's services are the only outstanding, I believe, children's services in the Midlands. So we've got a fantastic quality of care there, and we're now as close to normal as we could be in terms of the volumes of patients that we're treating, and long may that continue.
Thank you, Richard. Is there anything else, Dale?
Yeah, I've got another question. But yeah, that response is fantastic. I'm there myself tomorrow with my son because he has regular orthotics and physio, and I'd like to say that service has never really been affected. It's still been attending every appointment and none have been missed, so it's really good. The second question was, I've had an email today from a lady who was asking if you know anything about private health companies and when their staff may be vaccinated.
I've got no, I don't know. I don't know. There's one of two answers, neither of which I know which is correct. There could be an assumption that they fall under the NHS health workers and they're vaccinated, but that may not be the case. Or it could be that they'll just get picked up based around the sort of the other characteristics. I would suspect it's probably the latter. So that will be determined by whether they're shielding particularly vulnerable or probably by their age.
Yeah, fantastic. Cheers, Paul.
Okay, finally, I'd like to bring in Councillor Blagden, who's the Vice Chairman of the committee, and he's another Hucknall councillor. Jim?
Yeah, thank you, Chairman. What can I say, Richard? I mean, please don't be embarrassed by all the praise you're getting, because you and your staff deserve every little bit of praise you're getting. Let's face it, you've been on the front line of this battle with COVID-19 now for a year. And the Titanic struggle has just been beyond belief. And your staff and nurses have just gone beyond and beyond. They really have. So please don't be embarrassed. And I would love to thank them all personally, but I can't. So thank you very much. But at the end of it, you've already touched on it slightly, but at the end of it, when it's all calms down and hopefully we're coming out and everybody's had the vaccine, these people are going to need rest. Without a shadow of a doubt, they deserve it. How can we give it to them, or what pressure can we put on government to make sure that these people are given extra paid holidays so that they can go away and take the rest they deserve?
It's it's a fantastic question, and it's, for me, it's now the biggest concern I have. The biggest concern I've had for the last 12 months, as I've alluded to and people have picked up on, has been about the welfare and the well-being of colleagues. My concern now is you can see a lot of the sort of the conversation in the national NHS and some of the stuff in the media now moving towards right, we've come out of this wave, let's crack on now and start treating everybody. And what I see is a lot of the communication through the media is determined by what's happening in London. And London's 2 or 3 weeks ahead of the East Midlands and other areas. So London I'm from London, so lots of friends who work down there. London is in a better position, but the East Midlands is pretty much still saturated with COVID patients. And I'm concerned that the attention is already turning to, right, let's get everything going again. What can we do? I'm optimistic. I'm not hopeful, but I'm optimistic that the government will recognise, as you were describing, quite how hard people have been working, that people are absolutely worn out. And whilst in theory you can say, right, let's focus our attention now to everything else and crack on, and that might work for 2 or 3 weeks, but we need a long-term plan here. And the volumes of patients who are now waiting for treatment far exceed anything that we've seen for the last 10 years or so. So working exceptionally hard for a month isn't going to make a blind bit of difference. We need to have a plan that recognises this will take years and years to get through. And again, whilst things such as additional paid annual leave, I would classify as a nice thing. The first thing is ensuring that people can take their annual leave. The vast majority of people, myself included, have pretty much not taken any annual leave now for a year. We have to be in a position where they can take leave without feeling that guilt that I've discussed. And talking to the people, the thing that they want more than anything else is investment in the NHS, so that we can have more doctors, nurses and physiotherapists and clinical and non-clinical colleagues. Sherwood, we are lucky. We turned the corner a couple of years ago now, and our vacancy rate is far lower than anywhere else in pretty much in the Midlands. And I think that is because we've built a reputation for being an inclusive, a caring environment that prides itself on the quality of care that it provides. When we advertise, in general, we get multiple applicants for every job, but that's not the position of the wider NHS. So I would hope that, well, I know that the sort of think tanks and people who work in the lobbying world are lobbying already. I hope that the government will be receptive to it, but equally I recognise there's a huge political sensitivity to the fact that waiting lists have grown and these patients need treatment. So I think it's something that we all need to keep an eye on. And maybe just to conclude my point, I think the best thing that we can do in the short term is to continue to ensure, as you've all done, that people who work at Sherwood and beyond in any form of public service, not just healthcare and other sectors, that we recognise and are grateful for how hard they've been working.
Thank you, Richard.
Thank you, Richard. I mean, they could start by giving the nurses the pay rise they promised, but I don't want to be political, but I think that would be a boost to nurses' morale. I don't know if any senior officers would like to sum up or say a few words before we let Richard go, because I realise you're a busy man, Richard, so we don't want to keep you for any longer. But is there any officers that would like to say a few words before? Carol?
I'll go first, and Teresa can sum up, because Teresa takes the lead for a lot of the health partnership work. So I'd just like to speak on behalf of the staff at Ashfield Council, again, to thank you, Richard, and all of your team. I know it's a big team, and I'm in a similar position to you. I get to work from home, and my frontline team don't get that privilege of being able to work from home. They're out there every day. And they're feeling the strain at the minute as well. And so staff welfare is really big on our agenda as well. But I just want to finish by thanking you for turning up tonight, because I do realise the pressures that you personally are under in leading that organisation. And I'm sure members have benefited enormously from what you've said this evening. And we look forward to continuing to work with you in partnership. So thank you for that. And I'll mute myself again, and I'm sure Teresa would want to say something about that partnership. Thank
Teresa?
you.
Thank you, Chair. Yeah, like I say, we've got an extremely growing partnership, and there's a number of things that we've discussed recently at the board, only just last week, that I think us as a council and scrutiny members can support, and one of those being in the campaigns and some of the messages that we need to get out there to the communities. One, about our communities keeping safe at the moment to make sure they have safe practices in relation to COVID, but also encouraging the vaccinations. I can see that Joe Froggatt's on the call from the Communications Department at Ashfield District Council. So I'd like Scrutiny to think about how we can support both the hospital and the board in getting some of these campaigns and getting those publicised, to look not only through comms but also through our community engagement that we have and the targeted communities that we work with, and the role that members can play in that as well. So maybe one further discussion that we can have about how members can play a role in encouraging our communities to, like I say, not only sign up to having the vaccination, but also keeping safe in this challenging time. So just one for consideration, Chair.
Okay, brilliant. Well, on what I'd like to do then, with the panel's permission, I'd just like to make some recommendations to Cabinet. So on the basis that you just said, to continue the partnership working with the Trust, but also to formally write to Richard Mitchell to thank him and his staff at Sherwood Forest Hospitals and NHS Trust for their ongoing heroic work during the COVID-19 pandemic. So I'd like to propose that recommendation, and I'll formally move it. And have we got a seconder? Caroline and Dave, that's great. So I'd ask members then to we'll go to the vote. Those in favour, please indicate. Thank you very much. And Richard, I know you're a busy man, so thank you very much for coming to the meeting tonight. We're really grateful, and well done for all the work that you're doing. Yeah, I'll give a round of applause as well.
My pleasure. Thank you. I was reflecting. Normally at this time I'd be halfway home on the M1, so I used this opportunity to get home earlier tonight. So you've done me a favour. Thank you very much. Nice
Well,
to meet you.
we're glad to be of assistance. Thank you very much, Richard.
See you soon. Thank you.
Okay, so that's now to move on to item 5. This is the standing information item on the panel's agenda regarding the latest government guidance and restrictions. If you see the item attached from 21 to 42, providing guidance for the latest national lockdown. But before I do that, I'd like to bring in my Vice Chair, Councillor Blagden, who wishes to address the panel regarding this item. Jim.
Yeah, thank you, Chairman. Conditions, Chairman, remain a significant challenge, with the government looking at options to tighten regulations. The options the government are looking at include introducing a 3-metre rule, wearing masks outside in busy areas, scrapping support bubbles, scrapping childcare bubbles, restricting school access to children of critical workers, banning people from meeting to exercise, limiting exercise to 1 hour a day, increasing fines handed out for rule breaches, shutting nurseries for non-key workers, closing playgrounds, shutting car parks at country parks. We are expecting the government to make an announcement imminently. Chairman, I want to flag the excellent work of the finance team. I mean, I was at a finance meeting last night and what they're doing is unbelievable. The current processing position is 1,697 businesses have been paid a total of 7.666 million to date. The split, businesses with a rateable value, 1,332 businesses paid to a value of 7.098 million. Businesses without a rateable value, 365 of them, paid to a value of 568,000. Please note that the discretionary grant scheme closed at midnight on Sunday. The website has been updated to reflect this. There was a last-minute surge in applications over the weekend, around 70, taking the outstanding discretionary applications this morning, that was this morning, to 246. As such, we are expecting processing may take up to 3 weeks. This is an enormous amount of work on behalf of the panel, and I thank Pete Hudson, Bev Bull for their diligence and professionalism. They're an absolute credit to Ashfield District Council. And the latest coronavirus for Ashfield District continue to drop. Here is the latest area by area breakdown. As of January the 31st, the past week, there has been an increase of 83 since the pandemic began. 7,757 have contacted it. It just goes to show that we need and still need to be vigilant and follow the rules. If we follow the rules, we'll start to come out of it. Thank you, Chairman.
Thank you, Councillor Black. That's a comprehensive report, and I'd like to echo the praise for the Revenue and Benefits Department, because you know, it's all well and good money being handed down by government, but it's another thing making sure that it's appropriately distributed. And you know, the council have been superb. So thank you, Pete. You know, on behalf of the panel, we're so impressed with the work that you continue to do. And you know, I said at a previous meeting, I don't know when you've had any sleep over the past year. So I just hope that it gets better for you. Which officer is leading on this? Would any officers like to speak to the report before I bring in the panel?
I think, Chair, this report was to update members on the latest position. As with previous reports on the national updates that have come to this panel, pretty much as soon as they hit print, we've seen progressions either locally or nationally. I think what's important to recognise is pretty much what Richard Mitchell said about not becoming too complacent, that you know, people continue to act with caution and keep safe and encourage those vaccinations. I think one of the things that I did want to touch on, Chair, was something that Teresa had brought in with regards to thinking innovatively around how members could use their roles to encourage vaccinations and continued care in keeping safe during the pandemic. I think it's certainly maybe not a recommendation at this stage, but certainly something we can work with the comms team behind the scenes and the service directors, and just have a think about how members could use their community leadership role in an innovative manner. So at this stage, whilst it may not be a distinct recommendation, I think Teresa's points were extremely good, because I think members do have contact daily with constituents. They're probably the people that speak to the most members of the community on a daily basis, whether that be simply through their role of dealing with constituent issues about service delivery or health and well-being, etc. So I would like the panel to kind of bear that in mind, and we can certainly sit down and have a think about, outside of this meeting, maybe an innovative way of working with comms and you as elected members across the board, of how we can maximise the impact of your local leadership role. I think that's a really good point. I think that the one thing that, you know, as with everything we're doing at the moment, I am also conscious of, you know, we've got comms team that are working day and night to try and keep up and already do what they're doing. So I do think we do have to bear that in mind anytime we look at working with kind of other sections of the council. But that's certainly something I know we can have some conversations with Teresa and Joe outside of this meeting and look at what we could do and how we could do that. With regards to the actual report, it's all fairly self-explanatory. I'm sure all of you have heard it on the news. We hear the daily updates anyway. It's become a standing item on this agenda, as every time we hold a new meeting, Chair, there's been some national change or national update, whether that be further restrictions or you know, an update of the messages held. So I don't want to labour too much on the update. It is fairly self-explanatory. Obviously, if any members do have any questions with regards to it, you know, we'll do our best as officers to answer. We've got all of the majority of our senior management team here today, and obviously led by the Chief Executive. So I think I'll leave it at there. I've been wittering on way too long.
Thank you, Mike. I'd like to bring in another celebrity guest tonight. He's Councillor David Martin. He sits on the Health Overview and Scrutiny meeting and the Adult Social Care Committee at Notts County Council. So with your permission, can I bring in Des? Good evening, Councillor Martin.
Evening, thank you for that. Sorry I was late. I had another meeting to attend earlier. When we spoke to Jonathan Gribbin at the Health Scrutiny the other week, we said it was very, very important for the clinical commissioning groups of the NHS to get the message clear about where people were going to be able to access their COVID vaccines. And we were then, I mean, at that time, they were doing over 80s and then they moved into over 75s and clinically vulnerables. And it was essential that the message was clear. And in the initial phase, the message was everybody had to wait for their letter. Wait for their letter, wait for their letter. That's what we kept getting. And then very rapidly on the letter, it gives you a link to SwiftQ. And of course, that's the system what is using to book. Now, I'm finding a lot of confusion. I mean, it was worse in the first month when we were dealing with the octogenarians, but as we moved slower down the age ranges, it became easier to deal with people and technology. And tech buddies is one thing that the council could push as the communications across to the members of the public, because even the staff at the clinical commissioning group and Jonathan Gribbin himself dithered over whether we should be sending that link out. And now, of course, we're moving towards the more tech savvy generations and they're sending that link out. So when you Google it, you'll still find Kingsmill and Ashfield Health Village. And there's now mixed messages about across the whole county, in the country, in fact, which is very, very confusing for people because they're still doing over 70s. Now I'm heading there myself, I'm not there quite yet, but the over 70s are still getting a very, very mixed message about where they can access their vaccines. And a lot of them can Google it and some will get the grandkids on it, but they can't come and see them, can they? And I've said to many relatives, many people, that your relatives in Kent or Cumbria could do this for you online, but it's finding the local outlet. So at the moment, we've got Ashfield Health Village and Kingsmill, but as we're moving forward, we're in a transitional stage now where that's going to go out to pharmacies and doctors. And I think that is the message that the district council could help with and pick up and tell people whether it's at their doctor's surgery or not, but they're still using SwiftQ even if it is. So that's the confusing element for people. So some of the doctor's surgeries around here, from Jessup at Codner, they've been ringing people up in Jacksdale. You know, Selston's going to be doing the same in the next fortnight when they get their vaccines, and it's a bit of a mixed message. So one thing we could do as a council is contact the surgeries, ask them how they're doing it, and promote that through the council's comms team for each area in Ashfield. That's one thing that I think we could do. So we're reinforcing the clarity of message of the route of how they're going to access their vaccines. That's what I think.
You're right, Dave. And you know, I mean, it did cause a lot of confusion. I mean, I had a ridiculous situation where an 83-year-old Edith from Charles Street in Sutton Ashfield was being told to email this SwiftQ. Well, you know, I ended up doing it for her, but you know, it was totally confusing. Another issue that I picked up was the disappointment. You know, the two pilots for asymptomatic testing were in Mansfield and Walsall, and I got that their figures were quite high. But one of the recommendations I'll be making tonight is to call for mass asymptomatic testing in middle super output areas with the highest positive coronavirus figures in Ashfield. And the other issue that I'll be making a recommendation is to get the cabinets back in to push for the clinical commissioning group to progress the opening of a vaccination centre in Hucknall, because again, you know, again, we had the ridiculous situation where, you know, residents were having to travel to Ashfield Health Village all the way from Hucknall, and it just didn't seem fair. And if you look at the Hucknall coronavirus figures, they are very high. I mean, there's been spikes, but it seems to me to be completely ridiculous that there's no vaccination centre in Hucknall. So just to repeat the recommendations, to call for the council to push for mass asymptomatic testing in middle super output areas with the highest positive coronavirus figures, and to get the cabinets back in to call for the clinical commissioning group to progress the opening of a vaccination centre in Hucknall. So before I put that to the group, is there any members that would like to make any comments? Jim?
Yeah, certainly would, Chairman. As far as I know, and still do, Hucknall is part of Ashfield. But we really seem to have been left out in all this. I mean, Kingsmill, Kirkby centres, Hucknall, 40,000 people live in this town, nearly 40,000 people, and we've not got a vaccination centre. It's absolutely outrageous, it really is.
Yeah.
And I just can't believe that we've gone down this route, and we're having to go to City Hospital now, which, all right, is fine. But the health centres and doctors really need to step up now and start saying what they're doing. They've been so quiet in Hucknall, it's unbelievable. Unless Kevin knows something I don't, I mean, as far as I'm aware, it just seems so quiet.
Yeah, Councillor Shaw?
Can you hear me? Can you hear me, Chair? We've got the perfect facility that's not being used. It's the leisure centre. The ground floor, the floor space in there easily move people in and out of that area. And we as a council could actually say, you could use this as a facility. I think we ought to push this as far as we possibly can, because mixing people from one area to another is not the best way of moving things around. I recently was fortunate enough to have my jab through work at the Queen's Medical Centre, and the queues were around the corner. There were hundreds of people queuing up to get it done. They were all there quite willing to get it done, but the distancing was fine. So we've got a facility where you could have one room to do the necessary paperwork and the other room to do the clinical discharge of the medication, the parental discharge. There's no reason why we can't use that facility, Chair.
Okay, thank you, Councillor Shaw. Councillor Rostons, would you like to comment on this?
The GPs in Hucknall have been overwhelmed of late. as of last week, they were trying to get around to all the residential care homes, which we've got quite a lot of, not just in Hucknall, but around the district. So GPs were being used there. They have looked at various options already in Hucknall, which one was the John Godber Centre. Another one where they could get in and out was the Methodist Church on the Marketplace, both with parking. So they are already looking into that. But the GP practices, they've just gone through the flu jab and they've just been closing the practices for short terms while they've been going out to the care homes and doing the staff and the residents as well. So they are working on it, but they can't do everything. So no. it is in the scheme of things.
I mean, I spoke to the clinical commissioning group last week, and they said that Hucknall is on the accelerated list, along with Broxtowe, because they're the two major conurbations that don't have vaccination centres in North Notts. David, Martin?
Yeah, if I can just come back there, it's very confusing for residents, especially, septuagenarians now, that's where we are. And it's very confusing for residents because we have this message, wait for your letter, wait for your letter, wait for your letter, and then you book on Swift Queue. But in my area particularly now, we've got surgery practices from Lee Brooks and Codner and Eastwood ringing people up and telling them to come and get their vaccine. So it's a very confused message, that's what I'm saying. And we aren't, even the Selston surgery and the Jacksdale surgery, we've only got two, they're using the community centres nearby. They're not using the practices. And like Councillor Austin says, they've been inundated with ordinary winter problems and winter issues and flu jabs and taking the flak because people don't want to go to A&E. And that's the other side of it. So it's exacerbated the problem for the surgeries because they don't want to go to A&E. If they can get it in the pharmacy or at the doctors, they will do. So, any centres that are available for the practice. I mean, Wyburn's huge. It's got 12,500 people on its books, and Torquard's just as bad. So they're big practices. We're not talking 3,000 or 4,000. You add them two together, there's 25,000 folks nearly there, and then two practices. So
yeah, we've got
I think you're right, and it's something that I know that you've raised at the county council. The scandal of the lack of doctor surgeries in Hucknall, because Hucknall is the fastest growing part of the district, and it just doesn't seem right. Teresa, did you want to come in?
Yeah, just to clarify a few points and bring us back to where we were with what Richard was saying and the campaigning, that we as a council have got a role to play to help support our health colleagues. And I'd like the panel to consider that, how we do that. It's unprecedented times and it's all new to them, and whilst they're still learning, I agree we do have a role to play, and our estates team have offered all our council empty facilities or vacant facilities up to the NHS. So they are working closely with the estates colleagues to look at vacancies. And I know some of the councillors have put forward some recommendations. And I do recognise that, time is of an essence. But again, if I can just ask members to revisit how, again, and me and Joe will definitely get together after the meeting, because there is a lot of work and communications that we're getting out there. Totally take on board that comms department and the rest of the council are quite snowed under with other work, but there are opportunities that we can do to help our health colleagues and ultimately our communities to access all these facilities that they need at a great speed. Absolutely recognise that Hucknall has been late coming on this, but we now need to look at how we can support those colleagues in order to bring it on, and like I say, ultimately support those communities.
Thank you, Teresa. Dale? And then Joe. Councillor Grounds?
Yeah, I just wanted to come in to say that the NHS are stretched to the max. I mean, there's nurses that want to help vaccinate, but they're also torn between helping out in the ICU wards and keeping people alive. So one of the main problems with opening new centres is finding the staff to run them, because they've got to have somebody in charge, they've got to have office staff, volunteers, and then they've got to have vaccinators and doctors all there as well. So it is a big struggle for the NHS. But they are doing a fantastic job. I've been volunteering for the last 4 weeks at the Ashfield Health Village vaccination centre, and every day they are literally trying to come up with new ideas to improve the service, make it faster, make it more comfortable for the people coming in for the vaccines. When it first started, there was a lot of form filling out, a lot of waiting areas for the people, but now they've changed the system, so it's gone to paperless, and they're getting people in now. Literally, they'll come through the door, they'll have the vaccine, and they're back out within 30 minutes. And everybody I've spoke to has been happy with the service they've got. It's fantastic.
Have you enjoyed volunteering, Dale?
Yes, it's been brilliant. I've met a lot of my constituents. I've also been recognised by people from Nottingham that have seen what I do there at the children's hospitals, and everybody's been fantastic. There's a lot going off in the background. A lot of people volunteering times, because even a lot of the vaccinators aren't paid. They're volunteering their time towards it. There's even a doctor at Ashfield Health Village who's come out of retirement to help out. He wanted to volunteer, but they said, no, I'm going to give you a wage. And instead of keeping that wage, he's donating what he earns vaccinating at Ashfield Health Village, and he's giving that to the volunteers that are helping out and giving them something back for helping out rather than taking a wage himself.
Brilliant, Dale. And well done for everything you've done to help out as well. That's great work. Joe, did you want to come in?
Thank you, Chair. There's been a few discussions around the comms part, and I quite happily meet up with Teresa to discuss this further. Just wanted a little bit of clarification that I can add in regards to what happens at the moment. So Catherine, our comms manager, she attends 2 weekly meetings. So there's a weekly LRF comms specific meeting that she attends in terms of, so that's sort of
Go keep the jargon to a minimum. Local Resilience Forum.
Local Resilience Forum communications meeting. So across the county area to coordinate communications that are posted out from councils, but she also attends a weekly vaccine communications meeting with the county council and the CCG. So we are coordinating comms, and I do believe that we also send a briefing to members on a regular basis every other week in regards to those communications. So just to sort of clarify that you know we are working in partnership in terms of a joint approach to communications.
Okay, Joe, thank you very much. Are there any other members would like to say anything? Dale?
Yeah, I just wanted to come back in regarding comms. I'm back there on Thursday. I was wondering if Catherine would be able to come down and speak to the manager and put out a good message about how well the Ashfield Health Village is doing, because on Friday there was a lovely elderly couple that came in, and there was a big celebration, a big round of applause, and they was given loads of gifts because there was the 10,000th vaccine to be administered in that building within 4 weeks. So they are doing an amazing job, and it would be good for the council to put that out there.
Okay, yeah, we can suggest that, Dale. Unless there's anyone else to speak, I'd like to move now to the recommendations. So recommendation 1, to call for the council to push for mass asymptomatic testing in middle super output areas with the highest positive coronavirus figures in the district. And 2, to get the councils back in to call for the clinical commissioning group to progress the opening of a vaccination centre in Hucknall. So I'll move that. Have we got a seconder? Jim? Okay, I'd like to move for the vote. Those in favour? That's clearly carried. Thank you very much. I'd like to move on now to agenda item 6. This item is a corporate plan performance update. Members are asked to consider the levels of performance achieved against the council's corporate plan and corporate scorecard, whilst noting the significant levels of service provision today, despite the impacts of the pandemic. So I'd now like to introduce the Assistant Director for Corporate Services and Transformation, Joe Froggatt, to talk the panel through the corporate plan performance update. Joe?
Thank you, Chair. Yeah, I'm really pleased to be presenting this report to panel this evening. It's basically our regular update that we present to Cabinet on a quarterly basis in regards to our progress in terms of delivering the corporate plan. This recent report also incorporates, where relevant, any updates in relation to the impact of the pandemic on our continued service provision. So hence we thought it would be really good to bring this to panel for information for you in terms of mostly good, but also the ways that the pandemic has actually had an impact on some of the delivery of services and delivery of our corporate plan and our priorities. Just to because the report does actually include quite a lot of detail, so I have no intention of going through all of that, but just a few key things that I wanted to bring out in terms of good things or things where the pandemic's had a detrimental impact. So as we've kept reiterating, just to note that we are the only local authority in Nottinghamshire that has delivered all Tier 1 and Tier 2 critical services without interruption during the pandemic to date. And we work really effectively together as an organisation to deliver those services, redeploying staff into important roles that are outside of the normal duties. So making sure that we continue to deliver services. And we've also been supporting the delivery of humanitarian services across the district as well. So it's worth remembering that. And then also on top of that, as an organisation, we are delivering additional services above and beyond standard service levels. So for example, some of the campaigns that we've run in our waste and environment teams and the upcoming campaigns that are coming in the spring as well. In overall terms, by what we call Q2, which is the end of September, we measure performance in terms of delivering the corporate plan through what we call our corporate scorecard, so which is a set of performance measures. And those measures in that scorecard by the end of September were still in a fairly positive position. So 71% of those measures were achieving or exceeding target or within 10% variance of the target. And 61% of those measures had improved or within 5% of last year's performance levels. So the report does go, it's structured in a way so that you can see what we've been achieving and delivering as a local authority against each one of our corporate priorities. So you members can see at a glance the things that we've been delivering against, for example, our health and happiness priority. A few key bits to pick out there for you are things like the amount of funding we've made available to voluntary organisations through our Ashfield Community Fund, and the way that that funding has been used to support food through the Let's All Eat funded. We've funded 4 weeks of food to 278 homes. Also support for the Feel Good food project. And then moving on to our homes and housing priority. Significant amount of service delivery there in relation to dealing with the pandemic and the impacts of pandemic. 35% more households have been prevented from becoming homeless. A significant work has been done to make sure that our properties continue to be maintained, in particular where we have regulatory requirements, for example, through making sure gas safety checks are undertaken on an annual basis and undertaken in a timely manner to when that 12-month anniversary date it occurs. So 99.66% of our properties have been checked within that 12-month anniversary date. Also moving on to economic growth and place. your members will be aware that we are supporting high street businesses through the pandemic through the employment of COVID information officers, and they've made a significant number of visits since October in terms of offering advice and guidance to those businesses. Also, in terms of Idlewell's indoor market, up until the end of September, the market had retained 97% occupancy, which is significant. And also to bring to your attention that as a council, we do have an economic recovery plan post-COVID that has been developed and is being implemented. And we have been supporting through the business support team, we've been supporting businesses and residents with over 1,000 enquiries up to December last year. In terms of cleaner, greener, impacts of COVID that we see there, if you recall, during the first lockdown, you know, there weren't very many people out and about. So we have actually, as lockdowns have opened up and more people have been out and about, particularly in our parks, we have seen increases in the second quarter of this year of reports of fly tipping incidents. We think that is related to closure of the County Council's household waste and recycling centres during lockdown, and coupled with people being at home more. We have increased the number of investigations, and we've got an increase in enforcement on the back of that. Like I mentioned earlier, we're running successful campaigns. So in November, we run a Bag It campaign, and we've seen reductions in the number of resident reported incidents of dog fouling and also littering. Moving on to Safer and Stronger. So for members to note, we have responded.
Oh, it's just gone off, Joe.
Sorry?
Sorry, Chair, did you say something? We can still hear Joe.
Oh, can you hear me?
Yes.
Sorry, did my microphone move out of the way? Apologies for that. I'll carry on. In terms of under our Safer and Stronger priority, for members to note, we have responded to a significant number of antisocial and nuisance behaviour incidents between April and September, a 34% increase compared to previous year, which could be down to lockdown, more people working from home, and such like. And also I just wanted to pull out from the information in the report that domestic abuse remains a high priority. And as a council, we've actually appointed a new domestic abuse and vulnerability officer in October of 2020 to support us with that work. Like I say, we do recognise that is an area of priority, particularly impacted by the pandemic. Finally, our what we call our Innovate and Improve priority, just to pull out for members that the pandemic, if there's anything positive to be taken from the pandemic, is the push to more online and digital services. We've actually seen an increase, an 8% increase in payments being made online through what we call our e-store, and a sort of significant aligned decrease in reduction of PayPoint and post office payments, which actually incurs a cost to the council through transaction fees. As has already been mentioned, the amount of grants that we've paid out to businesses, the report contains the details there up until the end of December, and I know that that's increased since. But also to bring to your attention that we have made available a significant number of online forms, particularly for our benefits services and for test and trace applications. and the report details how many applications we've received through those online forms. So supporting people to access our services, even though you know, our receptions have been limited or closed. And finally, one of the significant things that we've introduced at the end of September last year was our new modern user-friendly website. We've been tracking statistics on the website in terms of improved user journey, or the customer being able to find information more easily. And as you can see in the report, we've got quite a few statistics already in the first 3 months of that website going live that's showing us that the customer journey is a lot easier now, and the customer is able to find information a lot more easier. Finally, I just want to bring to the attention those areas where we've not seen improvement, and areas that particularly relate to the council's critical functions. And as you can see from detail in the report, are particularly impacted by the pandemic. So for example, business rates collections, we've seen a significant reduction. So 46.41% at the end of September compared to a target of 53.8%. We recognise that that will be due to the impact of the pandemic on businesses, either forced to close or being significantly affected by restrictions that have been imposed. Rent arrears also has increased considerably due to the impacts of the pandemic on our tenants' financial circumstances and their ability to pay rent. And also bearing in mind that as an organisation, we've had to increase our notice period for seeking possession from 3 months to 6 months. So that further impacts on our ability to collect rent arrears and move arrears cases forward. Finally, the last area to bring to your attention is the time that it takes to relet what we call a void property. So one of our properties that when they become vacant, there's no other period of time to complete required repairs and then put that property out to let. Normally, we are sort of within the target of 21 days to complete all of that work and get properties out to let on average. However, the pandemic has actually had an impact on our ability to meet that target. Either because during the first quarter we were only letting properties that were essential lets, so for example to people who are homeless or fleeing violence, and then also the other impact on reletting properties is the work that needs to be completed in those properties, particularly if it's major works where we need to bring in subcontractors to complete some specialist works. And obviously they were impacted by their ability to do those works for us during the pandemic and periods of lockdown. So that's the basis of the report. Some key items that I wanted to bring to your attention as members in terms of the impacts of the pandemic, but also significantly how well we've been able to continue to deliver services despite the pandemic.
Thank you, Joe. I think we've had some technical issues with the chairman at the moment, who is at this moment trying to get back into the meeting. So I'll hand you over to the vice chair, who can then open it up to the panel for questioning.
Yep, thank you, Mike. Yep, I've got the panel in front of me. So, is any questions? Caroline? Unmute yourself.
That's great. I've done it. I think everybody at the council's actually done a fantastic job during these difficult times, and I think most of the residents realise this. I just got one question. The homeless situation. Do we know if there's any homeless people in Ashfield at the moment? It's just that there seems to be a more people sitting outside supermarkets begging for food. Just wondered if we do have homeless people or whether they're just on the take.
I can come back on that one. I'm not actually sure what the homelessness levels are like at the moment. It is something that I can go back and find out. It's not something that the data that's available to me in terms of a performance measure, but I can actually go back and find that out.
Is there something that the council can do about the people who are sitting outside the shops actually begging and asking people for money and food? It's happened to me a few times, and I've actually said to them, if you are homeless, you can go to the council and they will help you. They will make sure you've got food, and they'll also offer you accommodation. And the same person is sat there the following week. So I don't know if they're just doing it because they want more money or whatever. I just wondered if there was a situation that we can actually stop them doing it, because it's awkward when you're actually walking by and you're actually getting physically harassed by people because the shops won't actually move them on.
Thank you, Caroline. David? I've got you, Carol. David Martin, Councillor Martin.
Yeah, thank you. Thank you, Chair. Thanks for letting me back in. Yeah, thanks for the report, Joe. It's very, very interesting. And I can't applaud the staff enough, especially in the housing department and in the environment teams, really, because it's a really, really extremely difficult situation for the housing lads to be going in people's houses that sometimes don't really want them in there for the statutory compliance checks, electric, gas safety checks, and any other incidental damage that's occurred to their property for whatever reason. It's just unbelievable. And they're having to travel in their own vehicles and their own vans. And once one of them tests positive, the other one's got to isolate the numbers. So if anybody can give me the numbers on the housing team and how we're doing with that would be very helpful. Because I think we're suffering in the environment team on an up and down roller coaster with burying graves and collecting bins. So, you know, I don't know if Teresa wants to give us an update on the latest figures of that, but it's the same situation. I mean, the other week we had 3 area managers off with COVID, isolating, not actually having COVID, a couple of them did, I think. But, you know, I mean, the level of work that we're still managing to maintain and output is fantastic. It's phenomenal. And long may it continue. And let's not forget, of course, on top of that, we're giving out, you know, more than £20 million worth away in grants. And we're supporting businesses. We are going the extra mile, and the staff are doing other jobs that they wouldn't ordinarily do on top of what they're normally asked to do. And I just can't thank them all enough. And I think the people of Ashfield really ought to be extremely proud of all the staff at Ashfield District Council, because they actually have stuck it through, and it's been a hell of a year. And we're every week that Dale's in that Ashfield Health Village vaccinating people. I think we're just up to 10.5 million now. Every week that goes by is a better week for us. And I just think they've been fantastic all year. And I don't know if you want to update, Teresa, on the staffing levels in the environment area. I don't know. But the bin men, of course, they all work in a lorry. One of them gets it. They've all got to self-isolate, haven't they? So it's a really difficult situation, and I can't thank them all.
I've got you, Carol, and then it's Teresa, then I'll hand back to the chairman's back in. Thank you, David. Carol?
Yeah, in terms
I'll hand you back to the chairman now. It's Teresa after that, David.
Okay, Jim, thank you.
In terms of the homelessness questions, there's still an instruction by the government. In the first wave of the pandemic, it was called Everyone In. And we're still adhering to offering every homeless person accommodation, and we've maintained that throughout. I don't know how many.
Okay, thanks.
But as Jo says, she will find out and report back to the committee. If people are behaving in an antisocial way, aggressive begging, then we can deal with that through the antisocial behaviour team and the community protection officers. So if you want to let Teresa know whereabouts it's happening, and specifically if there's particular times that's happening, we can get someone down there, I mean, to offer them accommodation, because if we know where people are, we can try and help them. We've also got an officer who operates, it's Care, Grow, Live, it's a project that we have within the authority. And it's his job to go out and find street drug users, and again get them into the healthcare system. And again, if you know where that you've got people on your patch, if you let Teresa know, we can pass it on to the team and get people helped, because there is help available for anybody that's homeless or a street drug user. It's not a problem. I mean, they don't have to accept it, but the offer will be there from us. In terms of the environment, Teresa will come in with any further detail, but I just want to let members know that since the very first lockdown at the end of March last year, we have been collecting a daily situation report on the staff. Who's in work, who's working from home, who's poorly, who's got COVID. I mean, it's a very sophisticated list, and we ask people to report every single day. So we've got over 10 months worth of statistics now about who's been doing what, who's been where, who's been poorly, who's not, who's got caring responsibilities. And Craig Bonner manages that. It's a big colour-coded chart. It looks a bit like a Bridget Riley painting if you know her work, or a Paul Smith pair of socks if you don't. And we get that every day, so we know, because we analyse it on a daily and a weekly basis as to where we've got issues. The other thing that we've been managing is a cross-council list of volunteers. So in the first lockdown, we prioritised essential services and we deprioritised other services so that we could do all the humanitarian work. And we did that through volunteers being redeployed across the council. So we had people in our housing team that couldn't work in houses anymore. They were deployed into delivering food parcels. So we were kind of mixing and matching where we'd got needs and where we'd got people. This time it's been a bit more difficult because we've been delivering all council services as well as dealing with the pandemic. So yeah, a couple of weeks ago, it did get a bit tight within the waste team because we'd got maybe a couple of people off with COVID, and other people who work with them then had to go into self-isolation. So we drafted in some of the environment team to work on the bins. But with COVID, you're back at work within a fortnight, provided you haven't got any longer term sickness issues. And then the whole thing starts again. So this week we're all right. A couple of weeks ago, it looked like we'd have to draft more volunteers in or get agency staff in, but this week we're okay. So yes, the situation reports are helping us to see where we need extra resources and where we can get them from. And we look every day at where we might need that to happen. So I'll shut up now. And if Teresa's got any further detail to add, I'll look in her direction. Thank you.
Thanks, Carol. Teresa.
Yeah, thank you, Chair, and thank you, Carol. Not a lot to add to that. Very comprehensive, Carol, overview of the current situation. I think the only opportunity that we have at the moment, as Richard and Carol shared with us at the beginning of the meeting, is the opportunity to have some vaccinations. And that started within the organisation with some of the housing colleagues, and that is now being rolled out to some of the waste colleagues and cemeteries, and then it will be moving on to street cleansing. So that will give the organisation and the residents, some comfort that they are getting vaccinated. So I just wanted to add that to Carol's comprehensive feedback. Thank you.
Thank you, Teresa. Is there anyone else that would like to speak on this item? No, well, thank you, Joe, for your report, and Carol and Teresa. I think, I read it yesterday, and, it's very, very clear that despite the challenges this council are facing, they're mostly hitting the targets, and, it's impressive reading, and it's not just the statutory services we have to provide. A lot of councils across the country have stripped it back and are just providing discretionary services. And statutory services even, and the fact that this councillor and not just, I think I say it in every meeting, we've not just maintained a full bin collection service, but we're providing an enhanced bin collection service, and I'd be very, very surprised if we hadn't performed better than any authority, and I look forward. When's the Britain's Got Tidy Awards? Is it next week, Teresa? Yeah, hopefully. If there's any justice, they'll win the award. But it's a little bit like Russian politics, award services like this, you know. So, but no, congratulations to all the senior leadership team, and congratulations to every single council worker, because it's very clear that we're performing well above our way. So without further ado, I don't have to get people to vote on this, do I, Mike?
Sorry, Chair. No. So we're just noting that.
That's fine then. Thank you very much, everyone. And just to discuss the work programme, I believe Dale wanted to make a suggestion for the next meeting. Dale, can I bring you in?
Yeah, thank you, Chair. I was wondering for the next meeting, I'm in touch with a lot of charities that have been carried on running throughout the COVID. And I was wondering if we could invite some of those charities in so they could speak about the difficulties they faced during the crisis. Especially one that I know of that opened a centre halfway through the pandemic, and it'll be good to get their advice and their thoughts on how things have gone for them.
Is this the Riley Foundation?
Yeah, that's the one. Yeah, the Riley Foundation.
Okay.
Absolutely.
Well, I've asked Councillor Blagden to find one in Hucknall, and we'll have a look in Sutton as well. So, right then, that's it for the meeting. As ever, thanks to
Councillor Smallridge just wanted to come in right.
Oh, sorry, John and then Dave. I can't see it, you see, because it's now trailing on the top of the screen.
All right,
John.
It's just I've been making many phone calls and speaking to residents, inquiring about how they are and if they need assistance and everything. And they are 100% aware of how good this council is and what you're doing. So I think that the council employees should take a bow and a hand clap for that, because the public know how good they are.
Yeah, thank you, John, and
thank you.
You know, we'll pass that on. Did Councillor Shaw want to speak?
No, he's indicating not, Chair.
Okay then. So as ever, thank you to Mike, to Shane, and to Lynn for putting these together. That they are excellent reports that you know, really do sell what the council are doing. So if there's no one else who wants to speak, we'll get those charities contacted this week, and we'll get that rolling. But thank you very much. I think it's been a decent meeting. I'm not moving to suspend standing orders as usual, but I think it's been a very good meeting.
I think if we could just thank the officers as well, Chair, in terms of Joe and obviously the senior management team. Joe,
the one thing I'm always
was the last item.
The one thing that I'm always aware of is you know, the amount of support that this committee gets from senior officers. So thank you very much, and I look forward to seeing you at the next meeting. All right, see you later.
Thank you, everyone.
Thank you.